Hi, my name is Dr. John Thomas. You're watching this video because either you or someone you love suffers with a chronic health condition. What I'm going to do over the next few minutes is explain to you the concept of toxic load and how that toxic load can wreak havoc on your barrier systems of our body and eventually lead to symptoms. So let's go and get started. First thing we're going to do is we're going to talk about what are our barrier systems. How do we classify what our barrier systems are? Okay? So we have four main barrier systems. We have our skin, our lungs, our gut, and our blood-brain barrier system. And what these barrier systems are designed to do is they're designed to allow certain things to pass through that are supposed to, but keep the things that are not supposed to pass through out. Simple as that. You get the idea. Okay? So what are the things that create a toxic load that can break down or compromise our barrier systems that lead us to be unhealthy and then lead to symptoms? So what I'm going to do is I'm going to point out very briefly what are those things that can create load on our barrier systems. The first thing are food allergies or food sensitivities. Okay? These are things like gluten, dairy, soy, eggs, yeast, abundance. Everybody has different food allergies or food sensitivities. What happens is you eat the things that you are sensitive to, they continue to create inflammation, they can compromise our gut barrier and then lead to symptoms. The next thing is intestinal pathogens. Okay. And these are things like a parasitic infection, bacterial infections such as H. pylori. We could have yeast overgrowth, a candida overgrowth that can wreak havoc on our barrier systems. Right? These things can eventually break down our barriers and then lead to symptoms. Next thing is mold exposure. We also can have stress. And this can be physical stress, it can be emotional stress. Over time, that stress, due to possibly elevated cortisol levels, can compromise our barrier systems, leading to symptoms. The next thing is nutritional deficiencies. Okay. You can have a B vitamin deficiency, a vitamin D deficiency. You can have a deficiency in certain things that your body needs to regenerate and repair itself, and eventually in time lead to a breakdown in those barrier systems. The next thing is leaky gut. Okay? You have a poor gut, in time it's going to truly compromise gut function. Now let me explain to you what leaky gut is. The best way to describe this is the lining of your gut is like a screen door. It is designed to let certain things through and keep certain things out. When you get leaky gut syndrome, you get a cut in that screen door and it's fair game. Okay? Leaky gut can happen multiple ways. Okay? I explain this in other videos more in detail, but leaky gut syndrome or leaky gut can create more havoc on our barrier systems, primarily our gut. And it's something that has to be looked at and addressed. The next one is medication interactions. Now, if you are taking multiple medications, how those medications, those chemicals interact can wreak havoc and compromise and break down our barrier systems. Next thing are environmental toxins. And these are things that we're exposed to from the air we breathe, pesticides, things of that nature. All right. In time, those toxins can break down our barrier systems, leading to symptomatology. Right? Next we have hormone imbalances. we have hormone imbalances can compromise our barrier systems. Okay? Next we have compromised detox pathways. Okay? So a fatty liver, poor liver function, that can lead to a compromise in our barrier systems over time. Okay? Now, this is important because all of these things, or multiple of these things, they break our barrier systems, and then, and only then, do you become unhealthy, leading to symptoms. Okay, so this is a pretty brief and vague description of those things that can lead to compromising our barrier systems, leading to the symptoms you have. The big question is, how do you determine what your specific toxic load is? And that's done through testing. Okay, and you need a doctor that's going to think outside the box and explore the testing that needs to be done to look at and determine what your toxic load is that is compromising your barrier systems, leading to your specific symptoms to give your health back. Now, everybody's toxic load is different. One patient could have leaky gut, nutritional deficiencies, as well as medication interactions, while another patient could have a parasitic infection, food sensitivities, and compromised detox pathways. Okay? So everybody's toxic load is different. You got to do a little investigating, a little Sherlock Holmes work to get down to the true causes of what is wreaking havoc on your barrier systems. My name is Dr. John Thomas. I encourage you to call my office at 678-456-9122 for more information, or to schedule a case review, or visit us on the web at integratedhealthcarega.com. There you'll find many more videos explaining what we do in our office, as well as why you are feeling the way you feel. I want to thank you for spending the last few minutes with me, and I look forward to reinventing your life. Thank you.